Hello, Lewy Warriors. Joe here for Canadian Lewy Body Dementia Information, and welcome to a new episode of CLBDI Talks. This is the first episode of 2025, and I'm happy to be sitting down once again with cognitive neurologist Dr. Stephen Pasternak to ask some questions and cover some topics that we didn't get to talk about last time. So I'm looking forward to this great conversation, but first and foremost, Dr. Pasternak, how are you?
Doing okay. How are you?
I am not too bad. I'm very grateful for you taking some time to sit down and talk to us again. And I wanted to start things off with a question about, it's been a while since we last spoke. Have there been any, or has there been any medical news related to your studies or LBD that you would like to highlight? What kind of things are you working on now? Do you have any new research goals or plans for 2025?
Okay. So the thing which we're pushing forward on right now is a write-up of a clinical trial of a drug called Ambroxol, which is an over-the-counter cough medicine across most of the world and is not present in Canada or the United States. So we have a trial with 55 patients with Parkinson's disease dementia, which many researchers feel is very similar to Lewy body dementia, although there are differences. So this trial has been reviewed at a high quality neurology journal, JAMA Neurology, and we're responding to reviewers right now. So hopefully this will be published at some time soon. So now the question is where to go from there. The trial that we were working on was focused on Parkinson's dementia, and this is something that our reviewers thought that we needed to tackle first. But I have to say, wasn't my main strategy. We wanted to look at Lewy body dementia. So a surprising review of the literature on my part, I was actually looking at the neuropathology of Lewy body disease, and it turns out that a large fraction of patients with Lewy body dementia actually have Alzheimer's pathology mixed in, and a large number of Alzheimer's patients actually have Lewy body disease. And so often we want to, say this is this disease and this is not the other disease. There's actually quite an overlap pathologically. So what we have just applied for right now is for funding for a clinical trial where we will look at some Alzheimer's patients and some Lewy body patients, and we would actually test them to see. We would test the Alzheimer's patients to see if they had, well, first if they had Alzheimer's disease, but if they also, how much Lewy body disease they had mixed in. And we would test the Lewy body patients to see if they had Alzheimer's biomarkers. And we would then look at the effects of Ambroxol, which is our over-the-counter cough medicine, on treating both of these diseases. And we would see if the different groups were treated responded differently. So this is, of course, like a 5 to 8 year project, and we're asking for $2.5 million. So I don't know if that's going to go forward or when it will, but this is the beginnings of trying to bring up funding for this.
And I mean, from what we were discussing before we were recording, and also your explanation here, all of these things help us better understand not just LBD, but the wider umbrella of dementia and where they intersect and how they interact and how to treat them. So I think overall, I really hope that the grant goes your way. It sounds very exciting, and anything that can be used to better understand and treat these neurological diseases is beneficial, especially as the numbers of people with dementia, various forms of dementia, rises in Canada. So I think it's a great thing, and it's wonderful to hear.
So I would add that there are a number of trials going on in dementia with Lewy bodies, and it's not nearly as many in Alzheimer's disease, but there are many people working on this. So hopefully, with enough trials and enough effort and enough patient participation, eventually we're going to be able to treat these diseases.
Well, it is excellent to hear that there are so many trials going on, and even if some of them don't pan out the way that we hoped, you miss 100% of the shots you don't take. I love to hear the positivity and the optimism here, and I'm sure our listeners do too. Let's pivot to our next question. With the passing of the late great Gene Hackman, we see some of the dangers being highlighted of not having a proper system of support as a carer or caretaker. Um, could you tell me some things to watch out for or give some advice to the listeners who may be caring for a loved one with LBD, ways that they can better insulate themselves from being in a situation like that or take care of themselves as caretakers?
Yeah, so Gene Hackman's passing, well, I was going to say last week, but really 2 weeks ago or 3 weeks ago, or we don't really even know exactly when, just is sort of upsetting on so many levels. I mean, I mean, such a fabulous actor who would have such a severe cognitive impairment at the end, of course, is upsetting in itself, but it illustrates a whole lot of problems we have with caregivers. And so we don't know exactly what happened, but we can guess that his wife had severe pneumonia or a respiratory problem, and I'm that overtook her quickly. And sh while she was feeling relatively okay, she was afraid to leave him, and she didn't hadn't made arrangements to seek emergency care for herself until it became overwhelming for her. So this is basically a couple that probably had enormous resources, but had cut themselves off from the world and weren't getting support from people, and not as even people checking up on them to see how they were doing. And I mean, you've heard me say this probably many times. Often when I have a patient in my office, I'll say, "So how are you doing?" And my patient will usually say, "Well, I'm doing fine, doc." And usually I'm more worried about the caregivers than I am about my patients. So, I mean, what can we do about this? So we need to have activities for patients outside of the home. And this is so, for example, day programs or activities. And this does two things. Well, it's social enrichment for my patients, for people suffering from dementia, but it also gives the caregivers time off duty. And I just see that this is an overwhelming burden that builds up and up on caregivers, and it's really not good for caregivers and their own mental health and their physical health. And I mean, caregivers are, you know, age matched often to the people they're caring for. So they probably will have medical problems themselves, and they really need to take time off to deal with them. And mental health is just such a huge problem. So for patients, it's important to have activities and social enrichment, but for caregivers, it's important to take care of themselves, that they they dig up those support groups, that they talk to other people. Within the next 10 years, there's going to be more than 1 million Canadian families dealing with exactly this. And so it's so a caregiver may feel that they're completely alone dealing with this, but they're not alone. There's millions of other Canadians going through exactly this. So one of the resources I refer to a lot is the Alzheimer's Society. So they have courses, they have support groups. They'll know it's available in the communities. Um, even if it's not exactly the right diagnosis, it doesn't actually really matter, because a lot of the problems are overlapped, and it's just important for caregivers to have people to talk to to go through their own frustrations, and to get support from other people around them.
Yes, I really like the fact that you brought up and I know for some people listening it might be kind of flogging a dead horse, but the rising number of people that are going to be dealing with dementia diagnosis, being, whether you're a patient yourself or family, friends, caretakers. And we always say, knowledge is power. And there are resources out there. In fact, the local Waterloo region Alzheimer's Society chapter has has now gotten funding for a respite program for caregivers, where someone will come and give them a break. They have tons of resources available to them. There are resources available through the hospital now. There are resources available through your, neurologist, through your doctor. I think one of the things is that people don't want to feel like a burden. They don't want to, it's hard to ask for help or to realize something is out of your control. I think that people should not only proactively prepare for these kinds of situations by having the knowledge of what's available and seeking that stuff out early, but also having the conversations with their family, their friends, being frank about what they need, about how they're feeling. As someone who has dealt with caretaking myself, it is important. It is that whole metaphor of, you need to put the oxygen mask on yourself before you put it on somebody else, or else, you're going to pass out too, and it's going to be of no use, when things get choppy. So I think that's all great advice, but as I said, a lot of the problems facing carers and family members come from a lack of knowledge about what resources that are available to them. But there's also a fundamental lack of proactivity, which is something we've talked about again and again from our government when it comes to caretaker support and making life easier for people with dementia and their families, their caregivers. What can the everyday person do to help or start affecting change, or is there any advice you have for people who want to join the movement of asking for our politicians and governments to make life easier for these upwards of 1 million people that are going to be dealing with a dementia diagnosis in the near future?
So actually, I just wanted to go back to a comment that you made just a few seconds ago. You said that there are lots of resources out for caregivers. And so, yes, it's true, there are lots, but I really want to stress that they're not enough. So,
Mm.
for example, there is a wait list to get into day programs. There's a wait list to see people at the Alzheimer's Society. Um, and one of the things that people need to do is they need to think long term. So, very frequently in my office, I'll say, so, maybe we need to think about how we're going to take care of dad long term. And usually the answer is, oh yeah, but we're okay now. And really what I want to emphasize is that waiting lists for nice places to live can have so nice places to live can have 3-year waiting lists. I didn't say that sentence very well, but
Yeah,
we
you know
can
what?
go back. And so what that means is they need to be proactive. It means that you need to think about it, and you need to actually go out and do your homework. Because if you don't do your homework, what I can tell you is when you're often at wit's ends, the system is not going to be there for you.
It's one of those situations where, like, you would rather have that information and not need it for a while than need it and not have it in a crisis situation. And you're absolutely right for bringing it up. Proactivity, that's what we mean when we say knowledge is power. You having being proactive and seeking these things out well in advance. And I like that you said, you know, thinking about the future, and that there are people who say, "Oh, well, we're fine now," but it is very important to be prepared for any and all eventualities, and doing your due diligence and preparing for that stuff. So I do appreciate you pointing it out. And as you mentioned, there are things for people, support groups, and there are. I guess I shouldn't have said a lot. I should have said there are more out there than you would think, but there are still not enough. And so what do you recommend for people who want to affect change, or want to start that dialogue, or want to support people who are like, do you have any advice for listeners who might want to involve themselves?
So I don't know what the answer is, but but we are not getting the support that are from our government that we need. We don't have enough nursing homes. We don't have enough uh, PSAs or PSWs to help out people. We don't really have enough of anything, and we have not seen sort of the growth in any of these services that we're going to need when we have a tidal wave of patients. And so we need to make sure that our politicians are aware that there's a huge number of patients now that need help, and that number is just going to skyrocket, and we just need to be planning for the future. And but right now, how does it feel? It doesn't feel like we're making those preparations. I can tell you that, very, very few of my patients are actually going to the nursing homes that they've chosen in a calm, controlled way. Many of them are actually ending up on urgent placement lists because basically families can't care for them anymore, or they end up in hospital beds again. So now they're blocking an acute care bed because there's no other way to take care of them. And really, again, that's another thing that we really want to avoid in a situation where we don't have enough acute care beds
And I
for really anyone.
I think one of the things that people maybe underestimate, and we've said time and time again, we do have our advocacy letter available on our website, which is a great way to start a conversation with an MP or an MPP. But I think one thing that people could do, and that would be kind of just generally helpful, is removing the stigma around um, kind of dementia and dementia care, and starting to talk about it in with your friends, with your family. If you're listening to this and you are kind of shocked by what Dr. Pasternak is saying, an easy way that you can affect change is to talk about it with people, and to start that, to illuminate other people about you know the fact that we do need to be proactive, and we do need to be considering this stuff when we're going to the polls, or we're going to uh, um, you know community meetings, or that's a small way. If the more people know what's going on and know that we need to be proactive and we need to start affecting change, that is a grassroots movement, right? Like, it doesn't necessarily have to be protest shutting down a street, or you know spending a long time writing all of your MPs and MPPs, which you should do and could do. We have, like I said, the advocacy letter available. But even just having these conversations and removing the kind of stigma around talking about stuff like this, and in communities, thinking about building dementia friendly communities, and making it easier for caretakers and people living with dementia. I mean, these are all small conversations you can have at the dinner table or with your friends, and family, and you can start affecting change on a small scale. But everything starts with a small, you know, everything starts small and grows. So, um, but before we end today, is there anything you would like to say to people living with dementia or their carers? Any advice you'd like to give going into the warmer months? Anything that you would like to add on to our conversation today?
Just coming back to, for patients, it's important to stay as active as they can. But for caregivers, it's really important to take care of themselves, to take care of their physical health, and to take care of their mental health. Um, and I just can't say that enough. And 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 then to reach out to the organizations that do support caregivers and patients, including various Lewy body, Lewy body dementia organizations and the Alzheimer's Society. These are organizations that well, some of them get a little bit of government funding, but really they're not supported enough by our governments, and are looking for our support.
Well, I definitely agree. I think that we need to be looking towards the future. The issues are here now, and they're not going to get better without some proactivity and some action. But as we said before, there are more than you would expect. There's more resources out there than you would expect. Not enough, but they are out there. We do feature some on our website, the LBD resources page. and you can check them out for the Waterloo region there, and also some Ontario-wide resources and programs available. I wanted to thank you very much for your time, and I look forward to hopefully in the next few months being able to come down and visit you at the lab and chat more about what you guys have been doing. But thank you very much, Dr. Pasternak, and I hope you have a great rest of your weekend.
Thank you so much. Great seeing you.
You as well.